Hello and welcome to the Georgia Physical Therapy, Supervision and Delegation of Assistants and Aides. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to physical, occupational, and speech therapy practices. Members can access our wide selection of guides and sample policies on federal and state law, along with our guides and updates on private payers. Members can also simply email us at any time with any compliance or billing questions or arrange a phone call. We also offer more comprehensive services like compliance and billing audits, custom policies and procedures, and credentialing. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. The primary responsibility for physical therapy care assisted by supportive personnel rests with the supervising PT. Adequate supervision requires at a minimum that the supervising PT must perform the following activities: establish effective channels of written and oral communication, interpret and communicate critical information about the patient to the supportive personnel, perform an initial evaluation of the patient, develop a plan of care including short and long-term goals, delegate appropriate tasks to supportive personnel, assess the supportive personnel's competence to perform assigned tasks, provide supervision in accordance with the law, the patient's condition, and the specific situation, and identify and document precautions, special programs, contraindications, indications, goals, anticipated progress, and plans for reevaluation. And reevaluate the patient, modify the plan of care when necessary, perform the final evaluation, and establish a follow-up plan. It is recommended that the physical therapist supervise no more than 3 other supportive clinicians at any given time. Adequate supervision by a licensed PT shall include the following: evaluate each patient and interpret the results to determine and document physical therapy diagnosis, plan each patient's treatment program and determine which elements thereof can be delegated to the PTA, provide periodic reevaluation of the treatment program and of the assistant's performance in relation to the patient, perform and record an evaluation of the patient and his response to treatment at the termination thereof, and interact with the PTA in appropriate ways specific to the plan of care of the patients being treated by the PTA. Institutional setting means any nursing home, acute hospital, convalescent hospital, rehabilitation center, other inpatient facility by any other name, and outpatient clinic, which would include private office. The PT shall be present in the same institutional setting 25% of any work week, Monday through Friday, and shall be readily available to the assistant at all other times, including weekend coverage for advice, assistance, and instruction. The PT in the home health setting responsible for the patient shall supervise the PTA working with the patient and shall perform the initial patient evaluation to establish a physical therapy diagnosis, treatment goals, frequency, duration, and plan of care. Meet with the assistant no less than once weekly to review all patients being treated, document all meetings with the assistant and subsequent decisions, and be available to the PTA at all times for advice, assistance, and instructions. The PT shall be designated as the PTA supervisor in the school setting and shall perform all physical therapy evaluations to develop or amend physical therapy interventions stated on the student's individual education plan for the purposes of assisting with the achievement of educational goals and objectives, including frequency and duration of physical therapy services. Make an on-site visit to each student scheduled for direct weekly services from the PTA no less than every 2 months and no less than once every 5 months for students who are scheduled with the PTA once monthly or less. The on-site visit shall include but not be limited to a case review, reassessment of the program and physical therapy services, and review documentation prepared by the PTA. Document the on-site visit, including status of cases, programs, or services, status or change, and indicate instructions given to the PTA. Interact with the PTA in appropriate ways specific to the goals and objectives stated in the IEP of the student who is scheduled for sessions with the PTA, and be available to the PTA at all times for advice, assistance, and instruction. A physical therapist assistant shall use the letters PTA immediately following his or her name to designate licensure. As of now, Medicare requires that therapists in private practice or employed by a physician group be on site when an assistant is treating a patient. The 2025 proposed physician fee schedule will change that rule to general supervision so that therapists can be off-site when assistants are treating patients, though therapists will need to be available by phone. For states with more restrictive supervision levels, such as direct supervision, those therapy services are always furnished to the extent that is permitted under state law. And if it's required that you be on site by state law, you will still need to be on site when treating a Medicare patient. Most payers and state Medicaid programs defer to the state's physical or occupational therapy board rules for the supervision of assistants, but may require more frequent reassessments. TRICARE follows the Medicare rules and requires on-site supervision and have yet to propose a change to that rule. An aide is one other than a PT or PTA who is employed to assist a PT or PTA by performing only designated physical therapy tasks under direct supervision of a licensee as approved by the board by rule or regulation. The physical therapy aide must have direct supervision on the premises at all times when providing supportive activities for the PT and PTA. Direct supervision shall mean on the premises and immediately available at all times, and on the premises shall mean the immediate area of the patient. Physical therapy aides may perform the following tasks independent of supervision by a PT or PTA: clerical tasks excluding treatment documentation, transporting patients, assembling and disassembling equipment in treatment areas, housekeeping activities, assisting a patient in preparation for treatment by a licensee, assisting a patient after cessation of treatment by a licensee, or assisting the licensee during treatment provided by that licensee. Physical therapy aides cannot directly provision any patient intervention or prepare treatment documentation. This does not prohibit an aide from transcribing, recording, or copying treatment documentation generated by a licensee. Any treatment documentation prepared in this manner, however, must be signed by the supervising licensed PT or PTA, and by signing the treatment documentation, the licensee is representing that he or she either prepared the treatment documentation or supervised a physical therapy aide in the preparation of that documentation. A PT or PTA may supervise a maximum of 2 physical therapy aides when they're aiding the licensee's provision of patient evaluation and intervention. Medicare, TRICARE, and most Medicaid programs expressly state not to bill for the services of aides. Most private payers state that services must be performed by a licensed therapist or an assistant under their supervision. Do not bill for services provided by aides unless the payer guide expressly allows you to. I've never seen a payer allow billing for aid services and really would recommend never doing it. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We'll be adding many more videos soon.